So just to get started, can you just tell us a little bit about you and what you do, and then we'll kind of go from there?
Yeah, absolutely. So I am a health strategist, an integrative health strategist for women going through a high risk pregnancy, specifically a high risk pregnancy after second or third trimester loss or preterm delivery. And I got into this work because of my own personal experience of having gone through a very high risk pregnancy and an extremely preterm delivery and a lengthy NICU stay. And it was my personal experience that really opened my eyes to where the gaps are in our current system in terms of supporting women. And specifically, what I found is that there's no conversation about how to support the neurobiology of pregnancy in order to
Mhm.
actually reduce the risk of pregnancy complications and help you stay pregnant. And so when I kind of dove into the research after my son came home and I was ready to kind of start working on this, I found there's 70 years of research showing the impact of supporting neurobiology on actually extending pregnancy and reducing the risk of complications. And I thought, how come nobody's talking about this? And so I made it my mission because I know what it's like to have gone through this personally. And
Mhm.
even with the most incredible medical team, there are still gaps in that care. And I really thought it was so important to bring this message into the world and to teach women exactly how they can support their bodies to
Mhm.
improve pregnancy outcomes, improve maternal outcomes, fetal outcomes. I mean, there's so much that we can still do, even in a situation like that, where it feels like everything's falling apart. And I know that personally what that feels
Mhm.
like. And also, there's so much we can do. And I find there's a lot of hope in that. So that's what kind of brought me to this work today.
Yeah, that's awesome. Yeah, I think what you said about kind of losing hope and thinking kind of it's out of your control at a time. So it's awesome having you here and share your knowledge and experience. So you kind of have the two sides of it because you can
Yeah.
bring a lot of experience into this whole conversation. So kind of starting with premature babies. So for those those listening that aren't too familiar, what's considered a premature baby and what are some of the reasons babies are born prematurely?
Technically, a preterm baby or a premature baby is a baby born before 37 weeks. And even though, so due dates are calculated around 40 weeks. And so there is kind of a 3 week buffer that baby might be born before a due date, but is not technically considered preterm. What they're doing now in the last several years is we're considering a full term baby after 39 weeks. And then there's early term, which is kind of 37, 38 weeks or so around that time. And the reason for that distinction is technically you're delivering at term after 37 weeks, but we're finding that there are some additional developmental benefits of delivering after 38 weeks, ideally around the 39, 40 week mark, regarding neurological development, lung development for baby. But it's not so early where you start to see kind of longer term complications between the 37, 38 week mark as opposed to a baby born before 37 weeks. So long
Mhm.
story short, preterm baby is born before 37 weeks. And there's a number of reasons why a baby can be born preterm. And they're kind of split by complications that impact mom versus impacting baby. So maternal complications can be any number of pregnancy complications that either impact the pregnancy, impact the woman's health or the birthing person's health, and require that the baby be born early to save or support mom's health.
Mhm.
Or there can be fetal complications, for example, fetal growth restriction, intrauterine growth restriction, issues with blood flow to baby, issues with baby's heart rate, for example, certain complications regarding any number of body systems
Mhm.
during the pregnancy for baby that you sometimes can find with in more detailed testing, more detailed ultrasounds or more invasive testing that the providers at that point decide it's actually more beneficial for baby to be born so we can intervene
Mm.
in a way that we can't help the baby in utero, for example. And then there's also reasons such as drug abuse, sometimes alcohol use,
Mm.
recreational drug use, things like that. Sometimes it has to do with some blunt force trauma, for example, if mom
Mm.
falls down the stairs and, falls in a certain way or gets into a car accident. So sometimes it has nothing to do with the health of either one, but for some
Mhm.
reason, it's just the solution is to deliver, whether that decision is made by the medical team or made by the body for any number of reasons. There could be the reason to deliver preterm.